There are three key concepts in the Helping with Understanding section of the Invitation to Change approach. We'll cover each one in this video. First, I'll explain the value of understanding that your child's behavior makes sense to them. Then I'll discuss how one size does not fit all when it comes to finding help for your child and for yourself. And finally, I'll address the fact that ambivalence is a normal part of any change process. How you respond to it makes a huge difference. So why, when your child's behavior is anything but normal, would I tell you that what they're doing makes sense to them? You may not see it now, but using substances is just like any other behavior, such as exercising, going to work, eating a piece of cake. People use substances because they get something important out of it. It's not because they're crazy or bad or immoral. It's because the behavior serves a purpose. Maybe it helps them sleep, reduce chronic pain, lower their anxiety, socialize and connect with others, increase their confidence, any number of other benefits. These benefits really matter and make a lot of sense to your child. They keep your child going back to substances even as the negative consequences pile up. When you understand how and why your child's behavior makes sense to them, you can start thinking through ways to support them so that they need or want substances less. Understanding can also help you connect with them in ways that promote collaboration instead of fighting or disconnection. Keep in mind that understanding doesn't mean you agree with, condone, or like their behavior. It's simply an acknowledgement that they use substances for reasons that make good sense to them. That recognition and understanding will help you more effectively encourage change over the long haul. The second part of helping with understanding is realizing that one size does not fit all when it comes to change. Your child has reasons why their behaviors make sense to them, and their reasons are different from the next person's reasons. The things that will help them change are also unique to them. There are many, many paths to change, and it's common to hear many simplistic or directive suggestions for recovery. Go to rehab, go to meetings, go to IOP. While those suggestions may sound reasonable, they're not necessarily what's best for your child. Understanding how your child's behavior makes sense to them will better equip you to consider potential support options. Maybe they need treatment. Maybe they need more help in school or more contact with a supportive coach or mentor. Maybe they need medication or a healthier diet. Maybe they need help getting a job. Understanding that one size does not fit all will help you slow down and help your child find a way to change that works for them. May also help you find what you need. The third part of helping with understanding is the idea that your child's ambivalence is a normal part of the change process. Since your child's substance use makes sense to them in some way, they're likely to have mixed feelings about giving it up. Even if they want to change, they'll sometimes go back to the old behaviors because they still work for them. We don't have a delete button in our brains for behavior we're reducing or trying to stop. We have to learn new things to replace the old behaviors. And that takes time and practice and patience. How you respond to your child's ambivalence can help move things along or could set things back. You can learn effective strategies in the Invitation to Change, Helping with Action section, which includes communication, reinforcement strategies that will help you move through it instead of getting stuck. Further explanation of helping with action can be found in our book. You'll find a link to it in your workbook for this module. Now that you've heard about the three parts of helping with understanding, let's talk about why it matters. Remember, your child's behaviors make sense to them, and their ambivalence is a normal part of the change process. Understanding this can help you respond in more productive ways. It helps you avoid taking their behavior personally. That alone will likely reduce friction in your relationship and allow your child to be more open with you and to your perspectives. It can also increase your compassion for them and your desire to support them. When you understand what your child gets out of using substances, you're also better equipped to support alternative healthy behaviors. You can also find resources that support change in a way that is uniquely suited to your child and your family. When you help with new understanding, you make room for patience and calm, even when the process of change is challenging and full of setbacks. Finally, understanding your child will help you appreciate and love them as a whole person. As with anything, learning to help with understanding takes practice. Following the activities in your workbook will get you on your way. In the next module, you'll learn about the invitation to change approach, helping with awareness.
Awesome. Yes.